Hey world, I'm Nick,
I'm Amber.
and together we are Functional Movement Therapy. We are doctors of physical therapy here to help you prevent injury and improve your mobility. We've been getting a lot of questions on the website recently about how to improve shoulder strength and shoulder mobility after an injury. So that's today's video.
Yeah, so if you like what you see, click subscribe, continue to follow us, and comment below with any further questions, and come visit us at functionalmovementtherapy.com so we can help you with your needs.
Thanks, we hope you enjoy.
All right, so some of the impairments we see, or some of the diagnoses we typically see in the clinic, is adhesive capsulitis, aka frozen shoulder. So you're generally just going to have limited range into every direction.
Yep. You could also have a torn rotator cuff. Nobody wants to hear these words, but it can be partially torn, fully torn. There's a big scale of that, and it doesn't always have to be traumatic. So we can help you work through those things. What are some of the other ones we see?
So tendonitis or tendinosis, whether it's acute or chronic, it's basically overuse or poor mechanics of how you're lifting. People that have very hands-on jobs.
Right.
I mean, they're
Manual
lifting
therapy.
things all the time, and we know that people don't know how to lift correctly. So you can get just overuse injuries.
Sure. And speaking of overuse and poor mechanics, that leads us kind of the last major diagnosis, which is impingement. That has a lot to do with poor mechanics of the shoulder joints. And so really that's what today's exercises and class is going to be about, is regaining that range, improving your strength, and understanding of the mechanics.
So we also want to mention to you that there could be a few red flags. So these are issues that...
What the heck's a red flag?
Physical therapy, we think it's amazing, but it might not be able to fix these certain things. So a few things that you really want to look out for: tingling and numbness coming down the arm, because that actually could be coming from the neck and not the shoulder. So if you're having any impairments of the hand, any trouble gripping, that could be a red flag. It may not... We may want to look more into it, is what I'm saying.
Right, if you're not able to do basic things like just lift your arm a little bit, and you're really having some difficulties with sensation, those are things we want to look into as well. Pain that wakes you up at night, specifically with sweating or any type of weight loss, we're really looking into that further as well. Okay, those aren't just musculoskeletal impairments or body type of impairments.
Right, and one way you can know if it's musculoskeletal is your pain should be changing with movement. If literally everything you do is painful, or even just sitting still and not moving at all is still just as painful, then that's a red flag. It's something we want to evaluate further or refer you to a different doctor for.
So because we're talking about shoulder mobility, we thought we'd give you guys a preview of what full mobility looks like. So show us full flexion, Amber, or this forward motion. It's 180 degrees, okay? Shoulder blades stay down, shoulders stay level. Going out to the side into abduction. Same thing, 180 degrees is what we're looking for. Then we have external rotation. So the arm is up at about 90 degrees. She can get back to the wall, no problem. And then from there, also showing off her guns. Watch out. And then shows down into internal rotation from there. Just hair shy of 90 degrees is normal, okay? And then you've got internal and external rotation as well. So this is functional internal rotation, where you scratch your back. Amber's got great functional...
Or do your bra.
Oh, very important ADL. And just below the scapula to the mid-scapula, or just above, is about right. Most importantly, no pain, right? No clicking, no popping. And then functional external rotation is coming back to at the top of your back. And Amber's got about equal... her fingertip gets to about the equal position of her shoulder on both internal and external rotation. We also watch that shoulder blade move take us through forward flexion one more time, Amber. So as we move there's kind of the base of the scapula. There's a little bit of a winging as she's moving through range, and then bring us back down, and it comes back nice and symmetrical. And again, her scapula is flush with the back, so there's no scapular winging. So that's really important as we look through what normal and abnormal is. Thanks, Amber.
No problem. Okay, so now that we went over the normal ranges for your shoulder, we want to give you guys a few exercises to help improve your shoulder mobility. So what we actually are using is just part of our Swiffer. You can use a broom, a cane, anything you have at home really that is just a long stick. It will work, all right? So the first one we want to do to improve your shoulder flexion or lifting of your shoulder is this. So you're just going to clench the wand in both hands, all right? And then you
engage those shoulder blades.
Yeah,
right?
Engage your shoulder blades, keep them back and down against the surface. And we'll just say, for the sake for the video, that his right arm is the one that needs some help. So when you're actually lifting, you want to do most of the work with your left arm, okay? So it's helping the right arm go over. So if he's at the point of pain there, okay, or it's getting a little stiff, you know, we come right back down. Again, we want no pain, all gain. So just be careful with your range here. Don't push it.
Just go to stretch, okay? You'll have range of motion, stretch, and then pain, and that may be a very fine line. Find that fine line. Just go right to stretch.
Mm-hmm. And I would say, what do you think as far as sets and reps? I mean, when they're just starting out.
Really, really easy. Could be 2 sets of 10, could be 3 sets of 10. You're gonna work your way up. Really, what you're focused here on is getting that range of motion back. You probably won't have the endurance to go to 30 repetitions. Take a break. When that shoulder's tired, this is it'll be a little more strenuous than you think.
Yeah, again, just listen to your body. All right, so for the second motion that I did standing up against the wall where you're coming out to the side, again, same pole we can do this exercise for.
Thumb up.
Okay, thumb up over on the side again. This right side is the side we're working. And we are using the left side to actually push up and across. So it's actually more of a diagonal motion. His right arm is pretty relaxed there and his left arm is doing most of the work. So you get to that point just where you feel comfortable and then you come back down.
Right. You do not want to push backwards in this motion. A lot of people get stuck kind of making the turn here. And remember, this is kind of a semicircular motion here that this shoulder makes. So you're guiding with the left hand up and around to make that turn to come up towards the ear. And that's going to be your stretch. You're going to stretch just like we mentioned before. If you're having trouble coming up and out to the side, cheat forward a little bit. Okay, so instead of your hand being down here with the midline of the body, we're just going to come up above the pocket, above the hip, and then make that turn through. And you'd be surprised how much difference that little bit of range makes. And as you improve, boom, progress back down to the side.
All right, and then that third exercise that we want to give you for range of motion is that external rotation, or you trying to grab that seatbelt in the car, okay? Actually, you'd be doing it with this side, but either or, okay? So we want to use either a rolled up towel, okay, because we want a little bit of space in between your elbow and the surface that you're using. So you're just going to place it right under like so, okay? Yeah, open palm right on the end of the stick. And again, same thing, you're using the left side to push the right side back. His elbow stays right on the towel, okay? That's relaxing right there. And you're actually just going straight back. You're keeping your arm at that 90-degree angle. You're not going out with it. You're keeping it flexed and you're going straight back.
Yeah, really important to keep that 90-degree angle. I see a lot of people extending the elbow and you don't get the rotation of the shoulder. If this 90-degree angle at the shoulder hurts, right, you have any pain whatsoever, drop the angle of the elbow down. Say come down to 45, 60 degrees, something like that, and then start from there. And then again, as you progress, elbow comes up, okay? Stick with your 2-3 sets of 10, right?
I would say so, yeah.
And give yourself up to a minute to rest in between these sets. Don't rush it. Take it nice and slow.
Yeah. And again, I mean, don't get frustrated if you don't feel like you're getting any range at first. Continue to do these. I mean, it's going to get better the more that you get that muscle warmed up and flexible.
Right. And then these should lead into your next exercises.
Now that we've worked to regain most of the mobility in our shoulder, we want to strengthen, and we actually want to strengthen the shoulder blades.
You want to strengthen the shoulder blades?
You do, and most people ask this. We're working on our shoulder. Why would we want to strengthen the back and the shoulder blades? Well, the rotator cuff muscle actually ties into this whole scapular complex back here. It actually stabilizes you while you lift and you elevate. So it's very important to be strengthening back here. We're also going to be kind of looking at our middle and our lower trapezius, which helps in elevation of the shoulder. This muscle is often overlooked, but it's very important to stabilize.
Right. So what do I do here?
Okay, so you're going to lay down. We've got this towel roll just beneath his forehead, just for support, and this is called a W. So what we want to do first, before he even lifts up, is we want to try to squeeze these shoulder blades back and down. Okay, so see how he's kind of moving back and down, and then when you get this engaged right here, you want to lift up both arms toward the ceiling. Okay, and hold a couple seconds, and you can draw back in closer to the body, and then relax them down. Okay, try that one more time there. So, yep, engage, lift straight up, and then draw back and down. Okay, and down right there.
Ready?
Perfect.
Very important to breathe as you're doing this, and then trying to have a straight line between your hand, your elbow, and the side, the midline of your body. Again, is really, really important. A lot of times people will end up with this kind of angle as they're driving back and the hand's going down, not the proper position for the shoulder there. So, yeah, hope it helps.
Yeah. All right, so another exercise we want to show you for strengthening that rotator cuff muscle, we are going to use a towel roll just right underneath the elbow. Okay, you have this arm at a 90-degree angle, and you actually just want to lift straight up toward the ceiling, just like this. We're starting with no weight because you are working against gravity, but you can progress if you want to use a soup can or a light weight if this is feeling too easy.
Right. Progress up to, 5, 8, 10 pounds, typically at max early on, okay? And you want to train high repetitions because you're training tendon now. A lot of that rotator cuff is tendinous, okay? It's not as much muscle as you assume. These are really small muscles, and that's why a rotator cuff takes so long to heal, is because they are primarily tendons.
Right. And so after this move, we can progress. So he's coming straight up. He's at end range here, and then he actually wants to come up and then out. So we're actually adding some range of motion into the strengthening exercise. So show it all as one.
So my elbow is just off the body. I'm going to start with my shoulder blade, bring that hand up so I'm equal with the midline of my body, driving through all the way up, keeping my shoulder blade down, coming up and reaching all the way over. So this portion of my shoulder, this upper trapezius here, never rose up into my ear.
Yeah, it says always staying down. If you ever feel your shoulder getting into your ear, you need to stop because you are using neck muscles. That is not your shoulder.
Right, right. So that's my 180 degrees, nice and in line with the body. I'm keeping that down just like I was during the W, right? And then that elbow is just off the body again. So it's 1, 2, coming all the way up, back down, nice and controlled through that scapula. 3.
Perfect. All right, so this video was to help to improve your flexibility and mobility of your shoulder. We've kind of listed a few instances where there may be some red flags, so you may need to seek further assistance or different guidance. But please schedule a consultation, come visit us at the website, and we can help you further.
Comment below. Don't forget to hit subscribe. We thank you guys for your time and hope this helped. Take care.